Hi, Dr. Lindsey and Wendy. This is a video that tells you what to expect after a hair transplant with us. So you've had your hair transplant, we've already gotten done, we've sent you home with a head wrap on and your medicines and an instruction sheet that's featured in this video. It's also on our website in case you lose it. And we'll see you back tomorrow, the next day after surgery, and take your head wrap off. And you'll notice at that point that you have some swelling up here or maybe back here. If we did the back part of your head, but it should be a very quick visit, and we'll clean your incision line and make sure that nothing bad happened the first night. What bad can happen, Wendy?
You can bleed.
You can touch your head. That's what happens. That's bad. And you can't put a hat on. You can't lean your head back against the car headrest. You can't hit it on the door frame getting in. Those are the bad things that we don't want you to have. And so you come back the next day and it's a really quick visit. We just want to make sure that nothing bad happened and address it if it did, and make sure there's no bleeding underneath the skin back here, and show you how to clean your stitches. And then the next day, if you're local, you come in and we start doing formal shampooing. If you're out of the area, then you'll pour some water with shampoo in it over your head while you're in the shower. And we have an 18-minute video on the website that shows you what to do every single day. And then I would encourage you, if you're not local, email Wendy or me a picture of what you look like. You can do that every day. You don't have to send 10 or 20 pictures, but just one picture of what the recipient area looks like, and we'll get back to you very quickly with, hey, that looks great, that looks horrible and you need to come in, or you just needed a little bit more cleaning. That's the most common one. And so the second day you'll pour water over your head, and then the third day you start the shampoo, which we will do here or if you're at home. And tell them about that shampoo, Wendy.
So you have to use shampoo and conditioner. We recommend for you to do conditioner at least 15 minutes to leave it on. We will teach you, we will show you when you come in on the first day, because you must come in. So surgery day is day 0, the next day is day 1. And day 1, we usually will have somebody that we're cleaning that had, that's on day 2nd, and you can see how to do it if you don't want to come into the office. And then...
So how long do you put that conditioner on for?
15 minutes. 15
and any conditioner, or what do you recommend?
Any conditioner, something like that doesn't have any medicines, like to thicken hair, to regrow hair. We want it to be as natural as possible.
Or to change color. Whatever your wife has is fine, unless it blondes or redheads your wife, and you don't want to have blonde or red hair. And so you leave that stuff on there about 15 minutes, and then you just stick your head in the shower, gently.
Then gently scrub.
And wash off the conditioner, and you won't get it all off, so then you put on a little shampoo. What kind of shampoo, Wendy?
Any shampoo.
Any shampoo that doesn't change your hair color. So you don't have to buy anything fancy from us or any place. Just put some shampoo on there and rinse off the recipient area. And perfection's the enemy of good. You want to get most of that stuff off and a little bit of the kind of ooze and stuff that's around the hair roots. And then you put on a little baby oil, right?
Yes, the baby oil helps to just keep the dryness away, because you'll be shampooing often, twice a day. So it dries the skin and it gets a little itchy, and the baby oil does help it so it doesn't get too itchy.
And we've had people try all kinds of different oils. A lot of people from India don't have baby oil, but they have another type of oil that's common, and that's fine.
Yeah, tea tree oil, argan oil.
Olive oil works?
Yes, it does. Any coconut oil, a lot of them like coconut oil. It just softens those scabies too. And don't be, just enough to keep it moist. Don't, as a lot of people do, a whole lot. Just enough. Just make it shiny. And that's enough.
I kind of think that baby oil is like sex and money. It's hard to have too much. And so I would err on the side of too much baby oil for those first 6 days. Wendy's a little more frugal with the baby oil. There's some happy medium between there. But if you're coming every day, we'll tell you. And if you're sending us pictures, like a flag a fella just did, I said more oil. And then on the 3rd and 4th days, particularly if we do the front, all the swelling that you see the first day works its way down, and it goes around your eyes, and sometimes people can't open their eyes.
And that's normal.
It'll go away.
It goes away. The more you walk around, the faster it travels down. So don't freak out. Some people tend to swell up more than others, but in 5 days, you're basically back to normal in the face.
Yes.
Yeah.
And then on day 6, unless we tell you otherwise, because you've had previous surgery or your head's a little tighter than expected, on day 6, we'll take those stitches out of you and see you again and make sure everything's good. And then we have you started putting vitamin E or Mederma. I like vitamin E because it's cheaper. That's what I've used on me, but Mederma is fine. And you put that on your scar twice a day for about 6 weeks. And then we see you for a scar check at about 6 weeks, because that's the best predictor of when how a scar is going to be. If you have a good scar at 6 weeks, that's probably going to be good. If you have trouble with your scar, then we need to do something about it around 6 weeks. Anything else?
Yes. After you're done with the scar follow-up, or even the day 7 and day 8, you're welcome to come to the office anytime that you have a concern. Of course, give us a call. Let us know that you're coming, and just follow us through. We'll hold your hand through the whole year that takes for the hair to grow.
Yeah.
So, any questions, we're here. You have Dr. Lindsey's email.
Yeah.
He's really, really good at email. You just email him, ask him any questions, he'll answer right away. And if you call the office and, you explain us what's going on, most of the time I'll have you, come in so we could just make sure that, that we see you and we know that.
Yeah, it's no sweat to see you.
Yeah,
It'll solve your worryation, and that makes your life a lot easier until things start to grow.
Yeah, because, we know what's normal, how it's supposed to look, how it's this. And for you, it's brand new.
Yeah.
So most of the time, you're done with the stitches. That doesn't mean, okay, you're done. You're welcome to come. Any questions, you're welcome to come to the office. I mean, we'll stay in touch for the whole year, or 14 months or 16 months that it takes for it to grow.
All right, well, I hope this was informative. And again, this is for our patients. If you're using a different doctor, I would do what they tell you.
Follow their instructions, yeah. This is how we do it.
And we've done about 3,840 of these things. This tends to work well for us. Thanks for your attention.